Hi class, I hope that you all are healthy and safe. Right now I'm actually in my home and I'm going to be showing you how we're going to do a PCM1 Practical 1 virtually. We have students who are going to be performing a retake virtually and a student who's going to be performing this for the first time. And so I'm going to go through the process. Some of us do not have another person living in our home. And because of the current health situation, we're not going to have people coming into our home and performing this very close. If you have someone that you're willing to work with, they have to sign a lab release. But today I'm going to show you how to perform it if you do not have anyone at home. What you're going to need is your laptop computer. You're going to want to make sure that you turn the camera on. You want to be in clinical attire and definitely wear your name badge. Any other equipment that you're going to use, you can verbalize, because I know that for the most of us, we don't have wheelchairs and high-low mats in our home. And so we will describe the equipment with what we have in our home environment. You want to make sure that your laptop's going to be positioned in a place where you're going to be able to be viewed by your grader. Your grader can give you feedback, but think about having a surface that you can place it on so that you can adjust and be able to view yourself. Just like we would give you a case to pick from, you're going to have a case that's going to be provided to you by your grader. It's going to be on your screen and you'll be able to refer to it when you need to. For the purpose of this example performance, the case that I'm going to be using is an 80-year-old female who has a 2+ out of 5 strength per manual muscle testing in all 4 extremities, and she has reduced trunk control because of weakness and decreased endurance. So for this case, my patient needs to go from supine in bed into a wheelchair. Again, I don't have a high-low mat, and so I'm going to have to use the equipment that I have. Just like I would do my practical, I've set up my room the way that I want it. I would imagine to have my patient in a supine position, and for my couch, this is going to be my high-low mat. I'm going to perform infection control, and then I'm going to go through the normal process. So I would actually do my informed consent with my grader watching and going through the rubric grading me for the remainder of this performance. So my name is Bonnie. I am a physical therapist at the University of St. Augustine, and I am here to make sure that you are the patient that I want to work with. If you could confirm your name and date of birth. Okay, so now that you've confirmed that, I'm going to hopefully want to work with you today on getting out of the bed and into a chair. So this is going to be ideal because it'll help to progress your goals. It's going to help with your healing. It's going to also work on getting you more independent. If you do not want to do this, because sometimes when we have to move around, we get dizzy, we have discomforts, then we can do some exercises in bed. But again, I think this is going to be the best because it will help to be it'll be optimal for your overall function. It's going to make you more independent, and again, it will progress your health in a positive way. So I'm wanting to know if I have your permission. Do I have your consent to continue? And if so, I would proceed, and I would make sure if my patient had any questions, I could then ask that. I like to go ahead and make sure everything's set up, so I would go ahead and lock the bed and check it. I would want to make sure that my wheelchair is also locked. I could position the caster wheels in a forward or lateral direction to improve the base of support of my wheelchair. Remove my leg rest and put them into a safe environment. Make sure everything's set up the way that I need it. And then I would hand sanitize if I had contacted any surfaces that would allow for infection control. If I had a gait belt, I would go ahead and apply that on my patient in a supine position. I then am going to want to tell my patient what we're going to be doing. So once we're going to be moving in the bed, I'm going to go ahead and help you with what's called the swoop method. The swoop method, I'm going to be doing most of the work, but I want you to help me as much as possible. This is going to be the best bed mobility technique because it'll be matching with your strength and your needs. So Milo, go over there. The next technique is going to be called the one-person dependent transfer. For the one-person dependent transfer, once we're in a seated position after doing the swoop technique, we are going to go with, in the seated position, placing our hands in our laps. We're going to also position our feet towards the surface that we're wanting to move towards, and then we will go 3 rocks and de-weight and position ourselves into the next surface, okay? So once we are in the other surface, then I will get my patient back onto the bed or back into the chair. To be able to do that, we're going to be working with the head-hips relationship. So the head-hips relationship is when whatever direction your head moves in, your hip is going to move into the opposite. So if I need to scoot back into the chair, I'm going to have my head come forward and in the direction that's going to be opposite of what my desire is. So if my right hip needs to go back, my head is going to go forward and to the left. And I will assist my patient knowing their strength is a 2+ out of 5. I'd ask my patient if they have any questions, and then I would ask for consent to continue. So now I'm going to actually work with my patient to set them up to be able to perform the transfer. Milo, you are not my patient. I need you to come over here, baby. Stay. So for now, I'm going to be able to have my patient in the supine. I'm going to want them to be towards the opposite edge of the bed because I know I'm going to have to roll them into sideline and then do a swoop method into the side of my imaginary bed here that is my couch. So knowing that I have the ability to position my patient at the beginning, I want them to be a little bit away from me towards the opposite edge. From there, I'm going to go into sideline position. The way that I'm going to be able to do that is bringing my patient's upper extremity that's closest to me through full flexion if they have it to be in a reverse T position, 90 degrees of flexion going into abduction, having their arm resting in this nice position. I'm then going to bring my patient's head towards that extremity, cross the arm that's away from me over, asking them to assist as much as possible, but knowing that their strength is 2+ out of 5, I will need to assist. And then also bringing the leg that is opposite away from me in a crossed over adducted position. From there, I want to get my patient into sideline. Because they have been shifted away towards the opposite edge of the bed, I have enough room. So I'm going to place my hand on the shoulder, and I'm going to place my hand on the hip, and I'm going to, or the pelvis, and I'm going to, on the count of 3, move them towards me into sideline. So from supine to sideline on the count of 3. 1, 2, 3. Nice body mechanics by shifting at my legs, not just using my hands. From here, I want to tell my patient that we're going to come up to sitting, so you're going to help me as much as possible. But first I need to gather their legs and bring them into sort of a flexed posture. About 1/3 of the femur is going to extend beyond the mat. I just want to state too that my couch is low. So if I had a high-low mat, I would be elevating this because of my height so that I would have better body mechanics. In this position, I need to now weight shift laterally and do a unilateral shelf under my patient's trunk, and then come back to the lower extremities. And on the count of 3, I'm going to perform a swoop. When I swoop, I'm going to start with the legs and use the momentum of the legs coming off, and then assist my patient into sitting, stabilize at the pelvis, come back up to the trunk. In a seated position, I need to make sure my patient's okay. Sometimes when you come from a more supine or sideline position to sitting, they can experience dizziness and discomfort. So making sure my patient's okay, then I'm going to go from seated position and lower down the mat. If my patient needed to scoot forward, then I could do that. But I'm hoping that they're in a nice position and now their feet are on the floor. So from here, maintaining trunk contact, I'm going to position my patient's feet, angling their heels towards the bed. I'm going to tuck their hands into their lap to be able to reduce any risk of injury. And then I'm going to have my patient's gait belt, and on the count of 3 with my feet and my lower extremities clamping onto theirs for security, we're going to de-weight. So 1, and notice I'm looking in the direction we're going, 2, and then 3, pivot. Now that I'm on my wheelchair and I've pivoted, I'm going to make sure my patient's okay. And then from there, I'm going to have to take their trunk, bring it down and to the right, and shift back and to the left. Down and to the left, shift back and to the right. My patient's now into the chair. I have, my patient nice and secured. And then I'm going to make sure that I apply the leg rest for my patient, okay? So applying the leg rest for my patient, make sure that they're safe. And then finally, if they're okay, I'm going to be able to give my patient the call bell, ask them if they have any questions, remove the gait belt. At any time, if I had contacted something, I would have performed infection control. So if putting the leg rest back on, if I had contacted something that I shouldn't have, being able to use my infection control, and making sure I'm encouraging my patient to help. So even when I'm applying the leg rest, if they can help me in any way with lifting their legs, I know it's weak, and so lifting against gravity, that's going to be very difficult, 2+ out of 5, but still encourage them. Same with the weight shifting back. So reflecting on my performance, there is going to be an area that I'm hoping you caught with your rubric. So when I set up my wheelchair, there was something for a dependent transfer that I needed to perform. So thinking back, is there anything that I didn't mention? I said that I would have my wheelchair locked. I said the leg rest would be removed, and I said that I was going to be able to adjust the caster wheels. So something else that I need to think about for a dependent transfer is the armrest. So if I have a patient who's going to be going from my bed in a seated position into their chair, they need to be able to not contact the armrest. And so having the armrest on the side closest to where I'm going removed and then replaced is going to also be something that I need to consider. So once my patient would be transferred back, I then could adjust the armrest, make sure my patient is safe, and then move to the lower extremities. Having to perform this in your home environment is challenging, but if you know what you're doing, if you know the steps of the rubric, then it is very possible. Along the way, your grader might ask you questions. So if there's something that you're forgetting, if there's something that they're wondering about, if the equipment in your home is set up in a certain way that might be out of your control, then your grader is going to have to ask questions to make sure that they're getting the information, to know that you have the knowledge and the skill to be able to successfully complete this practical. There is going to be again, beginning positioning, ending positioning, that's going to, conclude where the patient is and also to initiate where the patient is. And then a clinical question for your grader to be able to ask. And so as you're looking through the rubric, don't forget about that clinical question. I'm going to be meeting with each of you individually, so if there's any additional questions that you need to ask, that will be a perfect opportunity, but you can always reach out. I know that this is, again, challenging because we are not in our clinical setting. This is not going to be ideal, but for right now, to be able to assess your skill, to be able to say policy, and also your health and safety, this will be an option that we can perform. I'm hoping that if you have any additional questions or concerns that you will just contact me and I will be able to work with each of you individually. And I look forward to the opportunity to be able to perform the virtual practicals with you. I hope that you find this video helpful and I will talk with you all soon.